This is part 2 of 3 of what causes low back pain. I'm Dr. Nate, and thank you for watching and tuning in. You can watch part 1 up here, and if you've already done that, keep watching. Today we are covering what the purpose of pain is and why all pain is real and not all in your head, and the 6 different factors that influence pain. All right, so what actually causes lower back pain? The answer is many things. And yes, I know that's frustrating to hear, and you're probably hoping for, tell me the one thing that is causing my back pain. Well, I hate to break it to you, but I really wish there was one thing. Then I'd be a trillionaire living in the clouds for being able to find out what it was. But alas, pain is multidimensional. First off though, let's go back to our previous point that was in part 1. Pain is protective. Pain informs us of potential or actual tissue damage and potential or actual danger. Pain tries to protect us from dangerous stimuli to keep us alive. The frustrating part, though, is that pain is not always associated with true danger, and oftentimes we feel and experience pain even when there is no actual danger. So remember the smoke alarm example, okay? So we talked about that in part 1. Just go back to that. All chronic pain starts as acute pain, and in acute pain, danger signals are sent from nociceptors in the affected body part. This is important. All pain is real. It's not imaginary. It's not all in your head. You're not making it up. I believe you. All right. Are we cool? Okay. So let's listen on. So the nociception danger signals are sent via nerves up to the brain. I mean, you can have pain without nociception, but that's another topic. And the brain then interprets these messages and decides whether or not and how much to pay attention to them. If the brain interprets these messages as highly dangerous, then we experience and feel pain. If the brain doesn't interpret these as dangerous, we don't feel or experience pain. So the feeling and experience of pain can occur with or without actual tissue damage. Our brain is a central processing unit that takes in information and creates meaning out of it. Without it, we wouldn't experience anything or feel anything. So no brain, no pain, or anything else really. Pain is an experience, a sensation, and a physiological process, just like our heartbeat increasing, sweat glands being activated by stress, or the feeling of our heart beating out of our chest. The stress causing our heart to be out of our chest and the feeling of our carotid artery pulsating is an automatic function in direct response to our interpretation of a situation. You can literally be sitting on the couch, hear a loud noise, and all of a sudden your body is on high alert, blood pressure increases, heart rate increases, pins and needles all along your skin. This is automatic. This happens with pain too, right? We're sitting on the couch, move slightly to the left, and all of a sudden we get a sharp pain on the right side of the lower back. Your heart rate increases slightly, pins and needles, etc. So why does this happen then? The answer is because our body is constantly trying to make sense of the world around us. It's trying to protect us from danger and keep us safe. Sometimes though, our body becomes overprotective, kind of like an overprotective parent.
Hey mom, can I go play with my friend Billy?
No, it's dangerous outside. You could get hit by a car.
But mom, Billy just lives next door. I can stay on the sidewalk.
No, you could catch a cold and that would be terrible.
But mom, it's 70 degrees outside.
When we have pain for seemingly no reason, no trauma, no significant provoking event, I tend to think of it like the scenario above. Like our overprotective parents, sometimes our body does the same thing, and in an effort to prevent all the bad things from happening, it shuts everything down. Unfortunately, many people experience significant pain and assume that immediately there is something seriously wrong. And I mean, who wouldn't? It hurts a lot, and it's our body's job to keep us alive. So from a biological and evolutionary standpoint, it makes sense.
Pain, bad. Human, rest.
And yes, that was a caveman impersonation. I don't have great impersonations, I'm sorry. What I'm not saying, though, is that pain is always inaccurate. There are a variety of causes of pain that are serious health conditions like cancer, Cobb-Aquinas syndrome, infections, fractures, and other reasons that do require immediate medical or surgical intervention. What I am saying is that pain is not always dangerous. And meaning, if you are having severe pain, this doesn't mean that your tissues, i.e. your muscle, bone, ligament, tendon, nerves, are degenerating before your very eyes. So what factors contribute to increased nociception and increased pain? Physical activity for one, too much, too little, or if you keep doing movements that you constantly aggravate your symptoms. Sleep, which is kind of a double-edged sword because pain typically makes sleeping more difficult, and sleeping less increases sensitivity that often results in more pain. And if you've ever slept 4 hours and you need 8, you know how terrible it feels. Brain fog all day, difficulty making decisions and staying focused, and just not fun. And then stress, if you have young kids, dealing with a stressful work environment, going through a rough patch with your spouse, parents, or friends, you better believe that that also plays a part in how much pain you experience. And this also typically leads to less sleep and worsening mental health and kind of this vicious cycle. And then also social relationships and engagement. Like, are you isolated? Do you participate in fun activities with other human beings? If not, then this is certainly an area of your life that you may want to consider working on. And then, of course, mental health. Uncontrolled anxiety, depression, and other mental health conditions leave you open to more pain and disability, likely due to more catastrophic thinking, self-deprecating beliefs, and additionally, high anxiety, like we discussed earlier, causes other physiological changes to occur, like higher blood pressure, cortisol levels, heart rate, and all that. So, why couldn't pain be part of that too? And then beliefs. So if you're afraid of your pain getting worse, and you're afraid or concerned that if you feel more pain, you must be damaging something, then you are at a higher risk for being more disabled and having more pain due to that belief. So to address this, coming to a better understanding of hurt versus harm is super important. And the last thing, nutrition. Less well studied, but there is likely something to the chronic inflammatory nature of processed foods and not eating enough fruits and veggies. And as an anecdote, when I get tons of fruits and veggies in my diet, I feel amazing. Each of these components are important to delve into your own life, as they can all play a part in how much pain we experience. So in summary, you hurt because your body is trying to protect itself from perceived danger, which can be accurate or inaccurate. Think like the smoke alarm and overprotective parent example. And then pain can occur with tissue damage or without tissue damage, and the severity of tissue damage does not predict the severity of pain. Many providers and patients alike have misinformed beliefs about pain, which can lead to higher levels of pain and disability. And I provided several examples above in the video which provide beliefs I strongly disagree with. And there are several areas of life that can increase or decrease levels of pain. Those include physical activity, mental health, social relationships, nutrition, sleep, and levels of stress. And then pain is always multifactorial, always, even with acute injuries. And I hope this was valuable to you. Would love to know what you think about what causes pain. Are these concepts new to you? Do they make sense? Do you think they're nonsense? I want to know either way. And there's much more detail that I could add to this article, video. I may well do more in the future, but this gives a nice detailed summary of what pain is. And then in a separate video, I'll be talking about how to solve the pain problem. And it may not be what you think, so be on the lookout for that. If you'd like to be notified, hit that bell, and we'll keep in touch. Thanks for watching.